her presentation, we will open up the session to questions and answers. Today's topic will be the role of supplements in a blood cancer patient's health. One of the most common questions that I receive as a part of this Nutrition and Wellness for Myeloma chapter is concerning supplements such as curcumin or vitamin D. How do they play a role in myeloma patients' health, precursor myeloma patients' health, even blood cancer patients' health? Dr. Golombick is going to share with us today how patients diagnosed with early cancers of the blood can try to improve their health status through diet and natural medicine. It is my distinct pleasure to introduce her to you. Dr. Golombick's desire to help patients is driven by the death of a very dear friend to chronic myeloid leukemia while doing a PhD studying the mechanisms of growth of cancer cells in a laboratory. During the painful years undergoing therapy for her disease, she noticed her friend was given no information on how to try to improve her health status and quality of life in order to enable her to fight the disease. She is now dedicated to educating people diagnosed with early cancers of the blood on how to try to improve their health status through diet and natural medicine. Her and her team's research has shown how certain supplements can improve certain markers of disease progression in the blood and bone marrow and improve immune function in some patients. A change in diet and lifestyle shows improved quality of life. So with that being said, Dr. Golombick, I am going to turn the time over to you for your presentation.
Hi, thanks. Thanks, Audrey, for that.
We're so excited to have you.
Thank you very much. Let me just get on to my presentation. Yeah. Right. Al. I'll just come here a sec. I've lost the where do I have it?
It's on Zoom.
Where is it?
Yeah, it's Zoom. It says Zoom. Right there. No, it's Zoom. Right there. Yeah.
Right, and where my
Yes. Yes, she. Your slide. Don't know where it is. Go down. Okay. Yeah.
Audrey, sorry, are you there?
Yes, and it looks great. I was just trying not to stress you out already.
I'm just trying to get to the slideshow. Okay.
Perfect.
Right. Okay. Thank you for that. I apologize to everybody. And I want to thank you for registering to listen to this talk today. And I'd like to thank Audrey for inviting me to talk to you today, and to Dr. Urvi Shah for introducing me to Audrey. The title of my talk is The Role of Supplements in a Blood Cancer Patient's Health. I've been asked to make this as evidence-based as possible, and that is exactly what I'm going to do. So I'm going to be presenting the results of our clinical studies. This is me, Terry Golombick. I am a research scientist and a nutritionist. Professor Terry Diamond is an endocrinologist at St. George Hospital in Sydney, and Professors Manoharan and Ramakrishna are hematologists working at Southern Sydney Hematology. And all these clinical studies were carried out in their clinics. So just a little quick background on blood cell formation, and the process is called hematopoiesis, and it occurs in the bone marrow, in the red bone marrow, and this is found in the skull, the pelvis, the ribs, the sternum, the humerus, and the femur. And it starts with stem cells, and these differentiate into myeloid stem cells and lymphoid stem cells. The myeloid stem cells form all these components of your blood, for example, the red blood cells and the neutrophils, and the lymphoid stem cells form our B cells and our T cells. And the cancers that I'm going to be talking about today form from B cells. So here we have our stem cell or progenitor cell, and it differentiates along this pathway into different cell types. And depending where the cell becomes abnormal, so that tells us what kind of cancer we are talking about. So for example, chronic lymphocytic leukemia occurs when the activated or memory B cell becomes abnormal. We get chronic lymphocytic leukemia. When the cell differentiates into the lymphoplasmacytoid cell, and this cell becomes abnormal, so we get Waldenstrom's macroglobulinemia. When the lymphoplasmacytoid cell finally differentiates into plasma cells, we get what we call plasma cell dyscrasias or plasma cell abnormalities. And this includes MGUS, smoldering myeloma, the various types of myeloma, and amyloidosis. And our clinical studies have been done with myeloma, amyloid, MGUS, smoldering myeloma, and chronic lymphocytic leukemia patients. So here is multiple myeloma, just a diagram showing you here's a long bone where the plasma cells are made. And when you get normal plasma cells, they produce antibodies, which are part of our immune system. When the cells become abnormal, they form multiple myeloma cells and they secrete abnormal proteins, and that we'll get on to that. So what is multiple myeloma? It's a progressive neoplastic disease, and it's characterized by high bone turnover, significant bone loss, and pathological fractures, which result in significant morbidity and a high mortality. So what supplements have we actually done research on? So the ones that are highlighted are the ones that we have clinical experience with. Curcumin in MGUS, smoldering myeloma, multiple myeloma, and early leukemia patients. We've done research with a mushroom extract called rice bran arabinoxolin or Ribrax. In Sydney here, we call it Ribrax. It has got other names, MGN3. It's made by a company in Japan called Daiwa, and we've used it in MGUS, smoldering myeloma, and early CLL patients. We've done a study with vitamin D in multiple myeloma patients, and we've done a study with something called 6-sugarol, which is an extract of ginger, and we've used that in myelodysplasia patients. We haven't had personal experience with green tea, omega-3, and probiotics, but there is evidence out there that they may be beneficial. So what actually is curcumin? Well, curcumin is a compound derived from turmeric. It is rich in antioxidant and anti-inflammatory activity, and to date, thousands of animal and human studies have been done with it. It's been found to be beneficial for a multitude of maladies, including cancer, patients with cancer, cancer prevention, heart disease, type 2 diabetes, depression, irritable bowel syndrome, osteoarthritis of the knee, and non-alcoholic fatty liver disease, and the list keeps growing. Curcumin has also demonstrated chemosensitizing and radiosensitizing effects. In other words, it makes cancer cells more sensitive to some form of chemotherapy and radiation therapy. So here we have the turmeric bulb, and it's ground down into powder, which is turmeric, and curcumin is actually extracted from this powder. There are various methods of extraction, one of them being acid ethanol extraction. How does it actually fight cancer? Well, it targets different pathways which are involved in the development of cancer. I'm just mentioning the one, the NF-kappa beta pathway, because this pathway is deregulated in many cancers that form in the blood and in the bone marrow. There are many, many pathways that it acts upon. It's also been found to inhibit osteoclastogenesis. Osteoclasts are cells that are found in the bone, and they are responsible for breaking down bone. The cells that make bone are called osteoblasts. And in multiple myeloma, and in some patients with MGUS and smoldering myeloma, the osteoclasts are actually more active. And this is what led to our studies with the MGUS patients, because they are at increased risk of fractures. And working with an endocrinologist, he sees patients with multiple myeloma, with MGUS, and with smoldering myeloma. So what actually is MGUS? Well, MGUS, monoclonal gammopathy of undetermined significance, and smoldering myeloma, they precede multiple myeloma. They are called myeloma precursor diseases. What is MGUS? I may be repeating myself, but it is a disorder of the blood caused by cells that form in the bone marrow. And these cells are called plasma cells, which are actually white blood cells that secrete antibodies. And when the plasma cells behave abnormally, they can overproduce an abnormal monoclonal antibody or a portion of this antibody. And this we call the myeloma protein or M protein. And this is secreted into the bloodstream and sometimes the urine. And this abnormal protein is usually found during standard laboratory or urine tests. What about smoldering myeloma? Well, smoldering myeloma is a more advanced stage of MGUS, and it is classified as a precancerous disease. How serious are MGUS and smoldering myeloma? MGUS is largely considered a benign condition. However, recent research suggests that some patients with MGUS appear to suffer from a greater prevalence of recurrent infections, ischemic heart disease, peripheral neuropathy, bone fractures, and renal diseases compared to those without MGUS. And the biggest risk with MGUS and smoldering myeloma is its possible progression to multiple myeloma. What is the risk of progression? With MGUS, it's 1% per year, and with smoldering myeloma, it's 10% per year. And the parameters that predict patients at highest risk include the size and the type of M protein. Obviously, the higher the size, the greater the risk. IgA patients have a higher risk compared to high IgG patients. It also depends on the plasma cell dyscrasia. In other words, the bigger percentage of plasma cells there are in the bone marrow, the higher the risk, and an abnormal serum free light chain ratio. What are the current treatment methods? Well, for MGUS, traditionally, medical practitioners advise watch and wait strategy. With smoldering myeloma patients that are deemed at high risk of disease progression are now being advised to intervene with the latest anti-myeloma therapies before the disease progresses. And those patients deemed to be low or medium risk are advised of a watch and wait strategy. What is watch and wait, and why is there watch and wait? Well, watch and wait refers to a period of time when a patient has no treatment for their condition. It's also sometimes referred to as active monitoring, and the patient will be monitored by a specialist usually every 3 to 6 months. Treatment will be delayed until such time as it is necessary, if in fact it does become necessary. In other words, if the disease progresses. So why do you have this watch and wait period? Because treatment of unselected early stage patients with any form of drug therapy is associated with increased toxicity and sometimes no increase in survival. Occasionally. What are the advantages and disadvantages of watch and wait? The main advantage of watch and wait is that a patient will not be exposed to the risk of drug therapy or radiation therapy any sooner than is necessary. And the main disadvantage is living with the knowledge that the patient may have cancer and waiting until progression until anything is done. And this approach often leads to a patient's anxiety. So, given the uncertainty of disease progression, early intervention with the aim of potentially slowing down or stopping progression of these diseases is a valuable therapeutic option. And studies have shown that early intervention with non-toxic therapies such as diet and supplements may provide benefit to patients with early blood cancers, regardless of their risk of progression. At this stage, I just want to mention that I'm not going to be covering diet. Dr. Urvi Shah has amply covered diet and slowing down progression of disease with diet. I'm sure you're all aware that she's going to be doing some nutrivention studies. I'm very excited about that, using diet and supplements and including curcumin in her studies to sort of validate these findings. So our studies with MGUS, smoldering myeloma, and curcumin. So as I mentioned, we tried curcumin to see if it affects bone turnover. So our pilot study was with 26 MGUS patients, and this was done from June 2006 to July 2007. And we gave the patients 4 grams a day of oral C3 complex curcumin. This is the curcumin we used in our studies, or placebo, to determine its effect on various markers of disease progression and bone turnover. And because of our findings, and I'm going to show you a few slides after, because of the findings with this pilot study, we followed the study with a randomized, double-blind, placebo-controlled crossover study. And this time we had 36 patients with both MGUS and smoldering myeloma patients. And again, we gave them 4 grams per day of oral C3 complex curcumin. And then at the end of the study, we gave the patients an option that if they wanted to participate in an open label 8-gram extension study. In other words, we started at 4 grams, and after 6 months, those that wanted to could continue in an 8-gram study. So the markers we monitored in our patients, we collected blood and urine at baseline at the start of the study, and then at 2 monthly intervals for the entire study period. And in terms of disease progression, we looked at full blood count, the paraprotein levels, the free light chains, and the ratio. We looked at beta-2 microglobulin, and we looked at percentage plasma cells in the bone marrow. And for bone turnover, to see how curcumin affected bone turnover, in our pilot study, we looked at this. It's a marker of bone resorption, and you find it in urine. It's a protein found in urine. And for our bigger study, we looked at this marker of bone resorption. Right, so in our pilot study, its effect on the paraprotein level was serendipitous. We weren't actually expecting to see a drop in paraprotein level in our patients, but we did in some of them in the pilot study. And this is what happened with their UNTX markers. So we found that it actually did decrease the UNTX marker as well. And therefore, we did that follow-on big study. I'm going to give you a summary of our results with both studies. I'm going to reference all our work. For each study I talk about, there is a reference included, so that if anybody wants to go back to the reference to get more detail, it's there for you to see, and it can all be found in Google. So in terms of the disease progression in our MGUS smoldering myeloma patients on curcumin therapy, we saw a decrease in the paraprotein level of between 12 and 30% in some patients in our studies. We saw a decrease in the free light chain ratios in some patients. We saw significant reductions in total serum protein and random urine protein concentrations. This was particularly evident on the 8-gram dose. We also saw a decrease in percentage plasma cells in some patients on long-term curcumin therapy. And at this point, I'm going to mention some patients, when our clinical studies were finished, wanted to continue with the curcumin. And because curcumin is a supplement that you can buy over the counter or order online, many patients have continued to take curcumin after our clinical studies. So I'll show you the slides of what our findings have been. In terms of bone turnover, we found decreases in the UNTX and UDPYD excretion. And this may be related to the direct effects of curcumin on osteoclasts, as we saw in the in vitro, in other words, in tissue culture studies. Now, this is a gentleman who at baseline, and this is all determined by a pathologist, at baseline, this gentleman had 33% plasma cells in his bone marrow. The brown stain here are the plasma cells. And after 2 years of taking curcumin, he had 15% plasma cells in his bone marrow. These are the studies, the references for the studies. As Audrey mentioned, everybody who's registered will be getting the slides from this presentation. So these will be there for you should you want to follow up on what I'm presenting today. Right, these slides, this is work that I have not yet published. This patient I continue to monitor, we'll call him IM. And when he started on our curcumin study in 2007, his paraprotein level was around the 26 mark. In August of 2021, in other words, 15 years later, his paraprotein level is around the 6 or 7 mark. So this has shown a slow and steady decrease in his paraprotein level over 15 years. This is his free light chain ratio, and values do go up and down. I'm sure you're all aware of that. But his free light chain ratio at the start of the study, and this patient is a smoldering myeloma patient, or was, his free light chain ratio was at the sort of 23 mark. And as of January 2020, it was at the 6 or 7 mark. His other immunoglobulins, in other words, his IgA and his IgM, because he is an IgG patient. So his IgA has actually increased over the years, reflecting an improvement in some of his immune function markers. So his IgA has gone this way over 15 or 16 years. His IgM, this is the same patient, IM in fact, has also increased over the years. And his IgG, which is the involved immunoglobulin, which was high at the start at 36 or 37, has now come down to the 17 or 18 mark. So this patient has shown a very obvious and evident benefit from taking curcumin because he is not taking anything else. This is patient KB, and he is also a smoldering myeloma patient. His paraprotein level was at 31 or 32, and he's now, well, as of April 2020, his paraprotein level is 16 or 17. Right, on to amyloidosis. As I mentioned, it's also a plasma cell dyscrasia on the spectrum of plasma cell dyscrasias. Now, curcumin has been found to have a strong affinity for fibrillar amyloid proteins. And in fact, curcumin has been used as a stain in slides for patients with Alzheimer's disease. So Professor Manoharan had an elderly gentleman patient with IgG lambda smoldering myeloma, and he had an amyloid at the top of, in his epiglottis. And his disease was progressing. He tried a few rounds of chemotherapy and didn't do well on the chemotherapy, and his amyloid deposit continued to grow. And so Professor Manoharan suggested he tries curcumin. And as at 5 years after starting curcumin therapy, his disease remained stable and his amyloid deposit remained stable. It stopped growing basically once he started curcumin. Here is the publication of this case report, case reports in hematology. And here is his amyloid deposit at the top of his esophagus after 5 years. And this was measured, obviously, using microscopy, and it just became a stable deposit. Right, curcumin in steroid intolerant myeloma patients. Our treatment regimens for myeloma patients typically involve a steroid, such as dexamethasone, called Dex. And this is used in combination with either an immunomodulatory drug, such as thalidomide, lenalidomide, or pomalidomide, or a proteasome inhibitor. And these are them, bortezomib, etc. And administration of Dex remains a challenge, particularly in elderly patients, because of its side effects, which include fatigue, weight gain, fluid retention, poor impact on mental health, osteoporosis and hyperglycemia, or poor diabetic control. And so Professor Ramakrishna had a number of patients who were not doing well with dexamethasone. And he suggested that they replace the dexamethasone with curcumin. And what he found was that, in fact, curcumin may act as a steroid-sparing agent. And we've published the study, data from 15 patients with myeloma who were intolerant of dexamethasone. These patients all did well by replacing Dex with curcumin and stopped struggling with the side effects of dexamethasone. And here is the publication for that study. Right, chronic lymphocytic leukemia, and we're still on curcumin. We'll get on to the other supplements. Now, chronic lymphocytic leukemia is the most common type of leukemia in the Western world. It involves mature appearing defective neoplastic lymphocytes, almost always B cells, and they have an abnormally long lifespan. And what happens is the peripheral blood, the bone marrow, the spleen, and the lymph nodes undergo leukemic infiltration. There is a patient with a lymph node that has leukemic cells in it. Just in a petri dish, this isn't what normal blood looks like. Here's a lymphocyte. In a leukemia patient, what happens is that the blood becomes infiltrated with leukemic lymphocytes. Now, symptoms may be absent, or it may include lymphadenopathy, splenomegaly, hepatomegaly, enlarged spleen, enlarged liver, and non-specific symptoms attributable to anemia, for example, fatigue or malaise. Now, most early leukemia patients, including stage 0 and 1, have elevated CD4 T cells, CD8 T cells, and natural killer cells. These are cells that are involved in the immune response. They're part of our immune system. And the higher the count, the better. It's associated with a good clinical outcome. So what we did is we took 21 early stage leukemia patients with significant lymphocyte counts, in other words, greater than 20 times 10 to the 9 per liter. And in this study, we gave curcumin as Mariva. Now, why we used Mariva instead of C3 complex curcumin? There is so much research going on with curcumin up to the present day. And one of the problems, the perceived problems with curcumin, is that it's not absorbed well from the gut. So there are many companies, natural health companies, laboratories that are trying to improve the absorption of curcumin. One of these is Mariva, and in Mariva, curcumin is bound to a phospholipid, claiming a 48% enhancement of absorption. And so in this study, we gave them 2 grams per day of Mariva curcumin, and we looked at the effect on the lymphocyte count, T cell population, and natural killer cells. So we collected blood samples at baseline and 2 monthly intervals, same as our other studies. But to look at disease progression, we looked at lymphocyte count, and we also looked at its effect on the immunological markers. What we found was that 4 patients, about 21, demonstrated a more than 20% decrease in lymphocyte count. And at the end of the study, 3 of them still had a lower lymphocyte count than at the beginning. And all 4 patients showed an increase in their lymphocyte counts when they stopped curcumin. 3 months after they stopped curcumin, their lymphocyte counts went up. And they had they also had an increase in their CD4, CD8, and natural killer cells, showing an improved immune response. I'll just show you one graph of this study. These patients are regular patients of the hematologist. So we had counts before the study. Here's the lymphocyte count 6 months before the study, 3 months before the study, and at baseline. Curcumin was started in this lady and her cell counts, her lymphocyte counts came down. She stopped curcumin here. 13 months after stopping curcumin, her lymphocyte count had gone right up. She went and bought curcumin and her lymphocyte counts came down. And this was 6 months after she restarted the curcumin. This shows the CD4 cell counts, not very good slide, but they did go up. So here is the reference for that study if anybody wants to pursue the information further. Right, our next supplement is Ribrax. Ribrax, or rice bran arabinoxolin. It is a proprietary formulation, in other words, a patent of rice bran extract and shiitake mushroom extract. It has also been extensively studied. It has found to have immunomodulatory, anti-inflammatory, pro-apoptotic, and chemosensitization effects. So, why Ribrax? Well, this lady here, Chaluchova et al., gave Ribrax to 48 myeloma patients at a dose of 2 grams per day, and she found that it improved immune function in these patients. We also found an in vitro study, in other words, in cells, in a petri dish, by these authors, that by adding Ribrax and curcumin together, it increased the killing of this multiple myeloma cell line. So we decided, let's combine Ribrax and curcumin because their action may be synergistic. And these patients that were all in our clinical studies, so the MGUS, smoldering myeloma, and early leukemia patients, most of them have an increased susceptibility to infections because they have low counts of immunoglobulins. So they are hypergammaglobulinic, making them prone to more infections. So let's combine curcumin and Ribrax. What we did is we took 10 MGUS and smoldering myeloma patients that had been in our previous studies, 10 stage 0 to 1 leukemia patients that had been in our previous studies. They'd all been on curcumin therapy. They were buying their own curcumin, so patients were on different doses. They'd all reached stable disease response as monitored by their bloods. We gave them 6 grams of curcumin as C3 complex curcumin and 2 grams of Ribrax in a divided dose daily. In other words, in the morning and the evening, they took curcumin and Ribrax. And then we collected their blood at 2 monthly intervals. And what we found is that 50% of our patients had low neutrophil counts at the beginning of the study. They also had increased ESR. ESR, or erythrocyte sedimentation rate, is a marker of inflammation. Many patients have increased inflammation in these cohorts. And what we found that 44% showed a decrease in their ESR. And some patients showed an increase in their other immune function markers. So what we can conclude from this study is that by adding Ribrax to curcumin, it improves the disease status in some of these early myeloma or early leukemia patients. It improves the inflammatory response in these patients, and it improves the immune status in both these groups of patients. And this is the reference for our study, this Ribrax study. Vitamin D. I'm sure all of you know about vitamin D. Vitamin D is actually a steroid. It's a pro-hormone. The main forms of curcumin are D3 and D2, or cholecalciferol or ergocalciferol. Very important. Most cells in our body have D receptors. In other words, they can respond to vitamin D. I'm not going to go into too much detail because there's much out there available. What we did is we assessed the prevalence and the significance on vitamin D deficiency in myeloma patients. So we had 108 myeloma patients who were followed for 10 years. So we had their D levels over a period of 10 years. And we divided these patients into quartiles. In other words, obviously 4 quartiles based on their vitamin D levels. For patients in the lowest quartile, in other words, this is 25-hydroxy-D, is how we measure vitamin D. And the lowest quartile, those having the lowest levels of vitamin D, which is less than 25 nanomoles per liter, they had the biggest disease, the largest numbers of disease markers. So their beta-2 microglobulin, their myeloma protein, their bone resorption markers, UDPYD, T-scores, which gives you an indication of your osteoporosis scores. Those in the lowest quartile had the worst levels. And the conclusion from this is that vitamin D deficiency may have an important negative impact on the indices of myeloma activity, bone turnover, and bone mineral density. And this has been published in the American Journal of Hematology, and here is the reference. Right, 6-sugarol. 6-sugarol is an extract of ginger. Gingerols are the main compounds in ginger root, and they give ginger its distinctive flavor. What are sugarols? Sugarols are the dehydration products of gingerol, either during storage where they dry or by heating it, thermal processing. Much research has been done on 6-sugarol, and it shows anti-carcinogenic, hepatoprotective, in other words, protecting the liver from injury, and anti-inflammatory activities. There's a recent publication on how sugarol protects the kidney from chemotherapy-induced kidney damage. So we did a study with 6-sugarol in patients with myelodysplasia. Now, the early bone marrow stem cell, as I showed you in the beginning, is the site of the transformation, is the site where the cell becomes abnormal, and it can transform to acute leukemia. 1/3 of patients with myelodysplasia transform. These patients have an increased serum ferritin levels. Many of them do. It's often observed in these patients. These patients are also watch and wait. Here's myelodysplasia. There's the stem cell. When it becomes abnormal here, what you get is an abnormality in red blood cells, white blood cells, platelets. So it's a trilineage dysplasia. And then if it transforms, it becomes leukemia. What we found in so our study design is it's a small study, which we now in the process of doing a bigger study. But we had 6 patients with low risk myelodysplasia. We gave them a little capsule of 6-sugarol, and again we did our 2 monthly visits. And what we found is that the ferritin level decreased in some of these patients. A higher ferritin level is associated with a poor prognosis. So this decrease in the ferritin level provided a definite benefit to these patients. Again, I'm not going to cover too much in detail, but here are the references. Here is our small study, the study. This is a recent publication. We're asking the question, is this an effective phytochemical for these patients? And we are hopefully very close to starting a bigger study with 6-sugarol. So the other supplements that I mentioned are green tea. There's evidence showing that there's promise in leukemia patients, early leukemia patients. And in fact, in patients with acute myeloid leukemia, there's a recently published study showing that green tea has benefit for these patients. Omega-3 and probiotics. I know Dr. Urvi Shah is hoping to include these in her nutrivention studies. A lot of work with probiotics and omega-3. We don't have personal experience with them, but they're definitely on the agenda for future research in our patients. So to conclude, taken together, our studies with patients with early hematological malignancies, in other words, MGUS, smoldering myeloma, and early stage CLL patients and myelodysplasia patients, suggest that early intervention with natural medicine compounds may lead to prolonged survival and a delay in progressive disease in some of these patients. Thank you very much for your attention. I'm sorry about that mishap in the beginning. These are my contact details, my website, and my email, and please feel free to email me if you have any questions.
No
Thanks.
need to be sorry. Thank you so much, Dr. Golombick, for that amazing presentation. I'm so excited about this data that we have and hope to see that ripple and continue as this continues to be a pressing matter for myeloma patients and other blood cancer patients as well. One of the most common questions that we have in the chat right now is, how do you determine what dosage of curcumin should be administered? And then there's a follow-up question that I'll ask.
All right, prior to these studies in the literature, a dose of 4 grams per liter was found to be the dose, or 4 grams per day, shall I say, was found to be the dose where you could detect levels of curcumin in the plasma of patients with that are taking curcumin. So if they took 4 grams per day, there was curcumin in their blood plasma. So that kind of was the starting point for a 4 gram per day dose. Having said that, I've got patients that cannot tolerate a 4 gram dose because that's fairly high. And some take a lower dose than that and continue to take that lower dose as long as there's stable disease. If stable disease markers start to show a worsening, then the dose can be escalated.
Okay. Do you recommend then, if a patient's interested in starting curcumin, for example, do you recommend that they're monitored by a dietitian or by somebody who is studying these kind of things?
I'm assuming that most of the people who are listening today are under the care of either some form of doctor is monitoring them. 3-month intervals, 6-month intervals, 1-year intervals. I'm assuming that they are going to be having their markers monitored at whatever interval they're being monitored. This will give an indication if they are stable, great, and or if they're showing a decrease or a benefit from the curcumin. We never measured curcumin levels in the blood plasma of these patients because there's debate and controversy if it's the curcumin or the metabolites of curcumin that have efficacy. So I hope that answers the question. Yeah.
That's good. And in the case of MGUS patients who are interested in taking these but aren't being regularly monitored by a doctor, what do you recommend?
Of course, my recommendation is to start curcumin therapy. I think curcumin in itself, as a supplement in itself, is beneficial. It has benefits for a multitude of maladies, as I showed you there. Anxiety even, or depression, or a general well-being, yeah, it has benefit to there. So let's put it this way, there's no harm associated. And in medicine, the primary intention is no harm. So if you can tolerate curcumin, some patients can't. It upsets their tummy. Some patients get a rash. If you have gallbladder issues, if you have kidney issues or liver issues, you've got to be careful. If you're on blood thinners like warfarin, you have to be careful. So, yeah.
Perfect. That was going to be one of my other questions. So thank you for answering it. And then a lot of people are wondering if there's a certain type of curcumin or brand that you recommend. As we know, I'll just follow up with a little bit here. As we know, we live in a marketing world, and
Absolutely.
therefore to get money, people will promote even something as beneficial as curcumin to be the one drug cure all cancer, but then they'll make the product quickly or ineffectively and add sugars and other
Yeah.
things into products. So is there recommended brands? I think that's why they're asking, are there recommended brands that you can recommend?
So I get asked this question a lot, obviously.
Mm-hmm.
The reason we used C3 complex and Meriva is because at that time in 2006, those were the ones that were available to us. I know the company that makes C3 complex. And the reason I recommend it is because that's the brand I have experienced that with. Having said that, and because curcumin is so well researched, there are products out there on the market which possibly have equal benefit.
Mm.
I don't know. I mean, there is information out there on which are good products and which are not so good products. I can't really say, to be honest, Audrey. I recommend C3
okay.
because I know it's available. Meriva is also good. I know, there are many good products out there. I think if you go with a reputable company, I think that's your best available option, to be honest. Or one
Perfect.
recommended by a naturopath or, yeah.
Awesome. Thank you so much. Lots of people are wondering, what is the difference between curcumin and turmeric? Is it the same thing? Can they be taken together if they're not the same thing?
They're not the same thing. Turmeric is the powder. When you grind the root of the turmeric bulb, as I showed you, you get turmeric powder, and you can buy that off the shelf as a spice. And Indian cuisine have been using it for thousands of years. Curcumin is an extract of that, so it's more potent. I know many people just add a lot of turmeric to their cooking, and well, that's good. But I think if you have a condition like MGUS or smoldering myeloma or myeloma, I think a more potent therapeutic tool is warranted, like curcumin.
Wonderful. Thank you. We have a patient here who's actually sharing her experience that she has been taking curcumin for at least 8 years. And she recommends that you start low and then gradually increase the amount taken because this helps with different side effects. And she currently takes 8 grams daily and is still smoldering after 11 years. So congratulations. And thank you for sharing. I see a lot of questions here about how would I know that I can't handle it? And you went a little over those symptoms, an upset stomach, or, if you do have comorbidities that you need to watch for. But I appreciate her practical tip.
Yeah, I agree with that completely. You started a low dose. I probably should mention here, I'm sure most of the patients here it's a blog called Margaret's Corner. Yeah. So she's a lady, I'm not speaking on her behalf, but I have followed her for years. I think she's smoldering I think she's over 20 years. She was advised to start chemo many years ago. She continues to be smoldering. She does take 8 grams a day. I think starting low dose is a good option, and watch if it gives you the option that if your markers are increasing, it gives you the option to increase your dose.
Mm-hmm.
8 grams a dose is really the maximum.
Okay.
Don't go higher than 8 grams. If it's not working, it's not working. Yeah, so I would take her advice as well. Yeah.
Wonderful. Okay, there's lots of excellent questions here. So I guess let's move on to, as we expected, there's several active multiple myeloma patients, people who have active disease that are wondering about curcumin. Do you plan to have studies with active myeloma patients in the future? And then in addition to that, do you see harm in them adding a curcumin in addition to their treatment regimen? And if you can't answer those questions, that's okay. I just wanted to be the voice.
Okay, and I will do my best. As always, and every patient that I speak to, everything has to be done with the consent of their treating doctor. If you decide to take curcumin, your treating doctor should be aware. My advice is that it can add benefit to a treatment regime. But again, your treating doctor has to be on board with this. The hematologists that I mentioned do recommend curcumin to myeloma patients who are on active therapy in whatever shape and form. I've seen a number of patients who over the years have been taking curcumin and their disease has progressed. They've undergone treatment, different forms of therapy. The disease has been knocked back, and they've done really well and resumed curcumin after their therapy and have maintained stable disease, going back onto the curcumin regimen. So is there a clear-cut answer? No, I believe it would be beneficial to all patients, but again, their doctors have to be on board. Some doctors have experience with curcumin in their patients. Some patients will say no. Some doctors will say no, and some doctors will say, give it a try. It depends on the treating doctor. It's very important for doctor and patient to be on board. Yeah.
Wonderful. And talk to me about future studies. What do you hope to see?
Audrey, what I hope to see is what Dr. Shah is doing with diet and supplements. In terms of us doing future studies, at this point in my life, no. What I'm doing is consulting to patients that wish to chat to me privately. At this point in my life, and I cannot see in the foreseeable future any being done here in Australia.
Mm-hmm.
I'm hoping some gets done in the USA.
Yeah.
I think the more evidence there is from patients, the more patients, that patient for sharing, that's wonderful. The more these patients share with their doctors, the more that is out there for the doctors to see. That's the hope, is that they take this on board.
Yeah, definitely. Thank you so much for sharing that. What about pepper extract with curcumin?
So as I mentioned, curcumin is poorly absorbed in the gut. Black pepper enhances absorption of curcumin. Black pepper actually enhances absorption of a number of substances. It pretty much acts on cells in the gut to sort of open the gap between cells in your gut, basically, to allow more substances to be absorbed.
Interesting.
Yeah. Junctions, the gap junctions, I think is what they call them. So that's why some preparations have black pepper added to them to enhance absorption. We did not use black pepper extracts in our study. Some patients cannot tolerate black pepper because it can provoke an irritability in the gut. Oh my gosh, unfortunately, each patient is different. Each patient is going to respond differently. It might be best for some patients.
Yeah, that's interesting. And I appreciate you saying that. Truly myeloma, as I speak for myeloma, but it is a unique disease, and what one patient reacts to doesn't mean that the same myeloma patient, or that is myeloma patient with similar disease will even react the same.
Exactly.
It's a little bit frustrating.
Exactly.
So we have a couple people asking, what form does it come in, curcumin? Does it come in a pill or a liquid form?
In all of the above. It comes as a powder capsule, comes as a powder tablet. There are now capsules that are with an oil, sort of an emulsified curcumin capsule. It comes in granules. Our one study, they made granules for us. Yeah, it comes in various shapes and forms. Generally, they're quite big tablets or capsules. So I suppose if one struggles to swallow a big tablet, one can cut the tablet in half or grind it up. Yeah, but in fact, there are sprays now. There are oral sprays, there's sublingual sprays. You can spray it under your tongue. You can spray it in your mouth cavity. I know that some are making pastilles so that you can suck on a lozenge.
Interesting.
Yeah, so I mean, just hopefully research gets done with all of the above.
Yeah, we have someone asking about curcumin IV infusions. Have you heard of those and do you recommend them?
Yeah. Do I recommend them? That has to be done under the guidance of a doctor, a medically trained professional. Yes, there are some doctors here that give curcumin IV. I don't know if any of them are published studies, but yes, it is available as an IV infusion.
Fascinating. Okay, thank you. And there's other questions, a couple more supplements that I want to hit about green tea. Some recommend it, others strongly don't recommend it because it interferes with chemotherapy. Do you have any formulated opinion on it?
Yes, green tea extract. I'm not going to say the same name. It's a long name. ECGC. It can interfere with some forms of chemotherapy. It does contain caffeine, so it can lead to palpitations in some patients. I think a study was started with a green tea extract with myeloma patients. I think it was stopped. I don't know why, and I don't know I don't think there was a published outcome. I certainly think green tea is beneficial. I think drinking a good quality green tea, 2 cups a day, it definitely has anti-cancer activity, green tea. I've recently reviewed a paper for acute myeloid leukemia patients, elderly myeloid leukemia patients, where they show definite benefit. So I'm not going to poo-poo green tea as a supplement. But at this point, I think just drinking green tea, 2 cups per day, let it brew. At this point, until there's more clinical evidence, that is my best advice, actually.
Awesome. Thank you. And as always, you've already stated this, but I would like to restate it. We always ask that you talk to your treating physician about any supplements or extras that you want to be adding. We are running a little low on time, but I want to ask just a couple more questions for you, if that's okay. Mary Beth is wondering, what are curcuminoids versus curcumin?
So the reason the preparation I used was called C3 is because it's got 3 curcuminoids in it. So there's curcumin, D-methoxycurcumin, and hydro. There are 3 different curcuminoids that are available in a curcumin extract. There's also various research out there on which curcuminoid is the most effective. I don't think the jury is out yet on which curcuminoid has the most efficacy. And I know that there's research going on. So C3 has got the 3 curcuminoids in it. And that's why we use the C3 complex extract.
Wonderful. And then the last question, do you have any recommendations on probiotics for multiple myeloma?
Look, I'm hoping Dr. Shah, her studies cover this, and probiotics, a good gut function is, as she shows, vital to so much of our well-being. Fiber in our diet, obviously. Yeah, there are probiotics that, as she mentioned, some can sort of overtake the gut, and then you're left with a gut that has less species, okay? And the aim is to have more species of gut microbiome, bigger diversity in your microbiome. I think a good probiotic is beneficial, particularly those struggling with gut issues. Gut issues often develop in patients with anxiety, with poor diets. If one has a good diet and you're still struggling with gut issues, a probiotic can be beneficial. It can be beneficial for, constipation or diarrhea. Again, a good source of a good probiotic. And again, there's so many on the market, so much literature out there, but multi-strain, single strain, it's a minefield.
Yes.
But a good one is beneficial, I believe. Yeah.
Thank you so much. And she's been mentioning Dr. Urvi Shah. Excuse me, my 2-year-old is home.
Okay. Happy birthday for your 2-year-old.
You can hear him crying in the background. She has mentioned Dr. Urvi Shah. I will be including in the resource email that we're going to be sending along with the slides, the recording. I'll be including the recordings as well of Dr. Shah's presentation so that you can have that information as well to supplement what Dr. Golombick has shared with us today. Thank you so much for being here, for sharing this time with us and sharing this information. I was asking you beforehand how the future is, and I hope that because she's a day ahead considering she's in Australia from me, so I hope that the future remains bright for you, Dr. Golombick, and thank you so much again for joining.
And for all of us. Thank you so much, and thank you to everybody for tuning in.
Thank you. We'll finish with just a couple of outro announcements, and then we can be on our way. Our next meeting is going to be on the 23rd of March, and we're going to be talking about how inflammation relates to cancer with Dr. Sarah Lee. There might be other myeloma crowd community events that you would like to listen into. Tomorrow, our minimal residual disease, or MRD chapter, is meeting to hear from Dr. Manny Mohudin about his opinion regarding how MRD status could be used as an endpoint for drug approval in clinical trials instead of progression-free survival or overall survival. The 25th is our African American myeloma chapter. We're going to be celebrating Black History Month by hearing from Dr. Brandon Blue, who is a Black myeloma specialist, and will be talking to us about how to overcome healthcare disparities in the Black myeloma community. Then the 1st at 1 p.m. Eastern is the myeloma financial chapter, and we're going to be hearing from Diana Valentine about the true cost of blood cancer and how to pay for it, especially what newly diagnosed patients need to know. The link for these events and even more events I have not mentioned is found at the bottom of the slide and will be included in that follow-up email I have been referencing. As always, I'd like to thank our sponsors, Bristol Myers Squibb, Amgen Oncology, Genentech Adaptive Biotechnologies, Sanofi, Janssen Oncology, Karyopharm Therapeutics, Takeda Oncology, and AbbVie. And a big thank you to each of you for joining us today and helping us build a strong myeloma crowd community. I hope that you have a great rest of your day. Thank you so much. Take care.